Hello, my name is Marlena Rogers, and this is my video blog for Forum 4, Module 8. I chose the 2014 ACA, or American Counseling Association Code of Ethics, to report on. The ACA Code of Ethics 2014 was designed for the development of professional counselors and to advance the profession of counseling. Six main purposes incorporate the Code of Ethics, and they include the purpose of outlining and providing guidance to the ethical practice of professional counseling, identifying ethical considerations, clarifying the nature of ethical considerations. The code serves as an ethical guide for courses of actions or treatment plans in the counseling field and establishes an expectation of conduct for the counselor. The code also supports the mission of the ACA. And finally, the code serves as a basis for processing inquiries or complaints concerning ACA members. There are 9 sections of the ACA, and they are identified as letters A through I. And in Section 5, or Section E, is where the evaluations, assessment, and interpretation section is. Given the studies that we had over the course of the semester, we spent a lot of time on evaluating tests and instruments, learning about the reliability and the validity and the importance of selecting your tool and instrument, and if it's appropriate for the population you're using it on. Do you have the skill set to implement the test? Do you know how the training to score it and interpret the results? And when I compare that information to what is outlined in Section E, it was a lot of reinforcement around all of the elements in terms of the professional integrity that a counselor must have when they're implementing or utilizing a testing instrument. For example, in Section E.2a, the limits of competence, it specifically outlines that a counselor should only use testing and assessment services for which they are trained to use and are competent to use. In Section E.2b, appropriate use and counselors are responsible for how they apply, how they score, how they interpret, how they use the instrument relative to the need of the client, and whether they score or interpret the assessment themselves or use the appropriate technological services to score it. What was really notable is the fact that not only did we talk about multicultural considerations, but they went on specifically in E.5.C to discuss historical and social prejudices in the diagnosis of the pathology of counselors, and stating that counselors recognize a historical and social prejudice in the misdiagnosis of the pathologists or pathologizing of certain individuals and groups. And as counselors, we need to strive towards being aware of those biases and work to address them. So not only were there unintentional biases, but those biases used in the instruments or selecting the instruments for inappropriate populations, resulting in misdiagnosis of individuals. And of course, we are bound to not harm our clients. So that's super important. In Section E.6.A, appropriateness of the instrument. Again, speaking about the counselor's responsibility ethically to carefully consider the validity, the reliability, the psychometric limitations, the appropriateness of the instrument. And use any other instruments that or aids or resources that may improve upon forming the conclusion, making the diagnosis, and the recommendation. And then in conclusion, Section E.9.A A talks about, and I'll only talk about one section, but it speaks about reporting. And specifically, in reporting assessment results, counselors indicate reservations that exist regarding the validity and reliability due to circumstances of the assessment or the appropriateness of the norms for the person tested. So it is within your responsibility ethically to ensure that the validity and the reliability of the instrument that you use is appropriate for the population in which you are utilizing it for. Now, also regarding the instruments, you need to make sure that there is sufficient empirical data, and that is directed in section E.9.B. And then also that you need to ensure that you're using the most recent version of the testing instrument. In section E.11, it speaks about obsolete assessments with outdated results, and that tends to occur if you use instruments that are outdated. Now, with a spiritual integration, I want to refer to Colossians chapter 3, verse 23, which speaks about working with a willingness at whatever we do as though we were working for the Lord rather than people. And so we are required spiritually, as well as ethically from our counseling ethics, to provide the most appropriate and most effective services when we're engaging with our clients. And we're bound to do that spiritually. We're bound to do that professionally. And we just need to make sure that we are trained and that we stay within our scope of practice. I thank you for listening to my video, and I look forward to listening to yours.